I'm so pleased to be joined right now by Dr. Brigham McMahon, who is the chair of the Clinical Endocrine Education Committee. Thank you so much for being here.
It's a pleasure to join you, Dina.
So when we talk about this idea of education, we certainly have to talk about the new requirements for board certification. And this is something that has been real challenging for the members.
That's right. It's generated quite a lot of confusion among endocrinologists who are doing their best to stay current with modern medicine and modern endocrinology and want to stay board certified. And the new requirements are relatively simple to understand, but have been confusing for people to choose activities that meet those needs.
I think they've also been a bit frustrating for people in terms of the timing and maybe the cost as well.
Yeah, many people feel like endocrinologists are very academically oriented, very current with knowledge, and really want to stay updated with medicine, and they're reading the journals, they're reading what's current, and they're providing excellent care. And some of them worry that new requirements don't reflect how they need to study and maybe feel more punitive than they are collaborative in a way to improve education and their own participation in self-improvement.
Since the guidelines are new, I think it's important to tell people where they can get the information for what the recommendations are.
Yeah, the recommendations have changed. The requirements are now to accumulate 100 points over a 5-year period rather than over a 10-year period, to take a proctored exam every 10 years, to do a patient survey activity somewhere in that 5-year period, and to complete a patient safety module somewhere within that 5-year period. So you can see there's quite a few new additional components there that can be tricky for some people to complete. Fortunately, the Endocrine Society is endocrinologist partner, and we have endoselfassessment.org, which is our website that outlines these requirements for endocrinologists to make it as easy as possible for them to work through the requirements, and have several products that are written by endocrinologists for endocrinologists to maximize the efficiency and effectiveness of that learning activity. The American Board of Internal Medicine also has their own website that keeps an MOC status page for every ABIM certified endocrinologist and allows you to readily see what your requirements are and what's left for you to do so you can work through the requirements. Finally, the American Board of Pediatrics, which is also doing maintenance certification, has their own webpage and their own services and products to help individuals who are participating in the pediatrics MOC process to move through their actual system of care.
It's very helpful so that people can navigate through. We've talked about some of the challenges, some of the frustrations.
Yeah.
Let's talk about the positives of maintenance of certification.
Yeah, I'm proud to be a board certified endocrinologist. I also maintain my certification in internal medicine. It's part of my professional identity. It's a way of demonstrating to my peers, my patients, my colleagues that I'm committed to putting myself out there and holding myself accountable for the best in endocrine awareness and knowledge. Many of the self-assessment activities are really terrific. I'm somewhat biased, but the Endocrine Society's modules I think are some of the best out there. They really are written to maximize the appropriate care of patients with a wide diversity of endocrine diseases. I mostly focus on diabetes care in my practice, so it's really helpful for me to do modules on thyroid or osteoporosis care or pituitary care, for example, and I found those very productive. And some of the modules, even on practice improvement in diabetes, as a diabetologist, I found productive. Auditing my own frequency of documenting foot examinations or eye examinations, for example, for my patients was helpful. Finally, I would say hearing from patients through the patient survey modules. You always learn something when you listen to your patients, and I just found that a productive experience for me and my practice and improved, I think, my ability to be an excellent endocrinologist.
So for others like you who feel very positively about these maintenance of certification, how can the Endocrine Society support them?
So the Endocrine Society has been really front and center of building the best possible products to help endocrinologists meet their needs. There are two areas where the Endocrine Society is really out there in particular. One is developing self-assessment modules that are essentially multiple choice tests, but they're for you. They're to help you improve. You take multiple choice tests, you read the feedback, you learn through the experience of actually trying to make decisions about the patients that are profiled in these vignettes, and then learn from that experience and get feedback. You can also see how you're doing compared to your peers in each of these areas. But we also have practice improvement modules that are designed, as I said, for endocrinologists. Androgen deficiency, thyroid nodules, and an upcoming one for pediatricians on congenital hypothyroidism. So we have these modules that allow you to audit and measure your practice so that you can improve in those areas too. Finally, we have essentially modules that allow you to prepare for the actual exams that are, again, designed to help you reflect on your own practice and optimize your performance on that exam so you don't have to worry so much about it because you're so well prepared.
Well, given the positives and some of the challenges, I think it's important for people to come together. Dr. McMahon, thank you so much for being here.
It's been a pleasure, Dina. Thank you for having me.